Hello, hello. My name is Jess, and this is Patient POV. Today we are going to do things a little differently. There is going to be two episodes posted this weekend. One is going to be with Kiara, and one is going to be with Nick. This intro is going to be the same for both episode 22 and episode 23. So, with Kiara and Nick, just because I posted them on the same week, I kind of felt like they were together sort of thing. So I'm going to have in the notes what the time is, so you can just skip ahead. But I'm really excited for you to listen. And Kiara is a 19-year-old who is from Australia, and she has some chronic health conditions. Pardon my stuttering here. And so she gives us the point of view of having a chronic health condition when she is through her elementary and high school years, which is kind of an interesting perspective to get to hear from. And we also talk about the Australian healthcare system because that's where she's from. So that's going to be part one of this week. And then part two of this week is a different episode. And I felt it wasn't going to be best to put them together because I was just going to line them up. Because I think the episode with Kiara is a little shorter than normal, which is totally fine. But I wanted to give you guys something else to listen to. So I interviewed a physiotherapist or a physical therapist, and he gave us a conversation about chronic illnesses, like physical therapy with chronic illnesses. We talked a lot about pain management, the mental side of it, as well as the physical side of it. And then we also had a conversation about like exercise intolerance and postural, like orthostatic intolerance, and how to help train both of those. And so it was a really great conversation. He doesn't have any social media, so I thought this would be a great week to kind of piggyback on another episode. But I didn't think it was good to put them together because they're very they're very different. They have nothing to do with each other, or not too much to do with each other. They're both kind of sports related. We talk about or like exercise related, but I wanted to keep them separate, just because A, it was going to make it super long, and B, I just think it was better to keep them individually. And yeah, anyways, so that's that. This is just for everyone who's listening. I'm stuttering so much because this is the second time I've recorded this intro. The first time didn't record my audio. And so I got these little mics so I can record anywhere I go. I'm currently upstairs in the kitchen area, which is why I blurred out the background in case anybody's watching, rather than having to clean everything before I before I start recording. And yeah, I'm really excited for you to listen and hear from them both. And if you have any questions, please feel free to DM me. I also have a really fun, big announcement coming very, very soon. Let's just say if you were to Google patientpov.ca, there is a chance you may or may not see something. And by may or may not, it's not posted yet, but depending on when you are listening, it might be posted. But yeah, so super big announcement coming very, very soon. And please feel free to subscribe and like and review if you so choose. And you can find me on Instagram at Jess_and_Elda, which is ELDA. And yeah, I hope everyone has a great week ahead. Thanks, guys. Hello, hello. How are you today?
Very good. How are you?
Good, thank you. Do you want to just start by introducing us to you, who you are, and what you do?
Sure. Yeah. So my name is Nick Moscow. I'm a physiotherapist out of Carleton Place, Ontario. I've been practicing for about 5.5 years now. I started in a physio clinic a long time ago. Back when I was 15, I started volunteering in one, and then I was a patient prior to that. So I've been in the physio game for quite a while, but yeah, actively practicing for the last 5.5.
Amazing. I love how you say Carlton Place.
Carleton
Carlton
Place.
Place. And so what is the education requirement to become a physiotherapist?
Yeah, for sure. So, obviously, outside of high school, first is a 4-year bachelor's degree. You don't have to be super specific with which one you take. You just have to kind of fill out the prerequisites.
Mm.
So I took a 4-year bachelor's of science degree in human kinetics from the University of Guelph. After that, I went to University of Western Ontario for a 2-year master's degree in physical therapy. So it's a master's of science specializing in physical therapy after that.
Amazing. Wonderful. Yeah. And so then what kind of patients do you see in your day-to-day clinic?
Yeah, so day to day, it varies. I'm at Heritage Fitness Gym, which is in Carleton Place, Carleton. Uh, um, so yeah, I see like basically an unlimited age range. I don't typically see like really young children. I have treated as young as 4 years old. I have treated as old as 98. So the age range is quite large.
Yeah.
I don't see 4-year-olds a lot, but when I do, they're awesome because they're the best. And so are 98-year-olds. It's pretty cool. You get to see in a clinic that you are like basically I run my clinic out of the gym, so I'm self-employed. I don't necessarily have like a niche people that I see, but when you're working in like private care, you tend to see anyone and everyone that has injury, illness, or needs recovery with something. So yeah, so really an unlimited age range. I'd say my average typical age range is kind of in the mid 50s to 60s. You know, people that are now retired or just out of work and they're starting to get into more physical activity or trying to get more fit and they end up injuring themselves
Oh,
inevitably doing something. That is my most typical age range, but I do see kind of everything in between.
very cool. Very cool. As a question that I always ask everybody that comes on the podcast, is there any movies, TV shows, or books you're really into right now?
Well, you know, I'm a big Star Wars
Oh yeah,
fan.
that is true.
Trying to get you to watch Star Wars for the last foreseeable future, which
Yeah,
hasn't worked yet.
has
But
not happened
yeah,
yet.
I'm trying to think. I haven't really been watching much TV. I watched a movie recently that is actually pretty good. It's called Ricky Stenicki.
Oh,
Have you seen
I
it?
haven't heard of that
So
before.
it just came out. Zac Efron, John Cena.
Oh, okay, yeah, yeah.
It's like definitely not for kids, but I thought it was gonna be like kind of like a slapstick comedy, like really not that funny. But even my wife enjoyed it, who
Oh,
I did not expect to enjoy it. It's actually a pretty good movie.
okay.
Ricky Stenicki, I think it's on no free ads. It's on Amazon, I believe.
Okay, cool.
Yeah, but yeah,
Yeah.
it's good. And then we're also watching 911 still, kind of
Yes,
on and off, but
yes, yes.
yeah,
No,
that's our current.
I took a pause on 911. That's on Disney Plus, right?
Yeah, yeah,
Yeah.
yeah.
And so I took a pause on it and then I started watching it again. So I think I'm on season 6 now.
Are you on? Is it the Lone Star one or just 911?
Just 911.
Yeah,
Yeah.
that's what we're on.
Good. Yeah, yeah.
Yeah, that's good.
Yeah. No, I like it as well. So then jumping into the questions,
Hmm.
we commonly hear I know I have a shirt from Lululemon that says movement is medicine.
Hmm.
It says like sewn underneath sort of thing they're saying.
Yeah,
So that's one of them. Is that true? And how is it true, or if it is?
yeah. Like so definitely like it depends on a lot of stuff. Also, every physio ever that is the number one response to almost everything is it depends. Because really it does. Each person is so different. Each illness is so different. Each injury is so different. There are very few injuries or illnesses where I would say no, don't move, move less,
Mm,
or oh, that hurts, well, you should just never move that, you should just not use it for a certain amount of time. Now obviously like ankle sprains, breaks, fractures, surgical
mm,
interventions, yes, you immobilize for a certain amount of time, but every study basically ever has shown that the as soon as you can move it safely, moving it more and moving it safely is better than not moving it.
mm,
So and that goes for like low back pain, again, even ankle sprains. Once you get past that early phase of immobilization, getting it moving. So, movement is medicine with the fact that that's how our bodies were designed, not just to work, but also to heal. I'll use an example in our knees. So, a lot of people, very common myth is that running is bad for your knees. I'm
mm,
sure you've heard it. I'm
mm.
sure
Yeah.
everyone on the podcast that listens to it has heard it. Running is bad for your knees. The cartilage in our knee joints only gets nourished and only receives nutrients through compression. So if we don't
Mm,
walk or we don't move and we just sit on a couch all the time, people go, "Oh, I've only walked 500 steps every day my whole life, so my knees are going to be fine." You will likely be getting knee surgery because the cartilage in your joints will actually degrade. And this is because the cartilage in your knee joint, when you compress it through running or walking, that's how nutrients and like um, basically like water. It has to do with like nutrients, water, and everything that your cartilage needs to stay healthy and reproduce cells needs from compression and extension. So basically, if you're not getting that exercise in your cartilage, the cartilage will literally wear down from not being used.
Oh, interesting.
So a lot of people go, "Oh, running is bad for your knees." No, running is actually great for your knees if done correctly and if done in moderation. Like obviously, if you're out running a marathon every day, your knees are going to wear out.
Right.
But there's a certain line where you've got to move. You've got to keep your knees moving. Otherwise, the cartilage will start to wear down. So at almost every aspect of like rehab, staying healthy, movement is medicine in many different ways because our bodies were designed to move. So if we don't move them, then the stuff starts to break down. And then the old cliche of if you don't use it, you lose it
Mm,
happens, right? And then a lot of people also go, well, movement, like what is movement? Like movement doesn't have to be a 20K run.
right.
Like movement doesn't have to be me going out in the gym and squatting 300 pounds that day. Movement can literally be 10 minutes on the floor, stretching my hips out.
Mm,
It can be going for a walk. Like it doesn't have to be a 1 hour session of like high intensity cardio. It's movement can be literally just getting up, doing something that maybe you don't do all the time, or maybe to get your heart rate, let's say, up over resting heart rate, right?
right.
So anything that you do, that is movement. And I thought a lot of people kind of like, oh, I'm not doing enough, or I should be doing more. Yeah, if you sit at a desk for 8 hours a day, yeah, you should probably do more than just sit at a desk, go home, and then sit and watch TV all day.
Right.
That's not a lot of movement.
Yeah.
But like sometimes 15 minutes of mobility is enough for that to help, right? To get that, like I said, the cartilage in your knees will then get some compression, it'll then get more fluid in there. The discs in your back, same thing. They work on the same principle where they only get nutrients through the compression extension because there's not blood vessels in your cartilage, there's not blood vessels in your spine, in your disc space to get nutrients. So they only respond to compression extension. So that's why movement is necessary. Is apart from all the other cardiac implications, for the muscles, joints, bones themselves, they
Mhm.
benefit from movement because that's how a lot of them get their nutrients is through that, not just through blood flow.
Okay.
So
Very interesting.
yeah,
Yeah, yeah. No, that's really cool to hear. But
yeah,
and then before we keep going, can you explain like what physio is? Like everybody hears like, oh, I go to physio, but like,
yeah,
what is that?
yeah. So physio, so yeah, physiotherapy is like actually only a name used in Canada. In the States, it's called physical therapy. So like if like you saw my degree on the wall there, it says Master of Physical Therapy. So
Oh, okay.
it is literally what you would think it is. It is therapy of anything physical. So anything injury related, upcoming surgeries, post ops, injury, illness, any type of pain people can feel in their body. There's very few things that we can't treat with regards to like musculoskeletal injuries. There are kind of three distinct areas of physiotherapy. So obviously, I'm in MSK, so musculoskeletal injuries, private, if you will.
Mhm.
There is then hospital, or what's called acute care. So acute care is specifically a physio that works in the hospital. They may work in a cardiac unit where they're monitoring people's heart rates. They're trying to improve people after a heart attack or people who just had surgery on an open heart surgery. So that is called acute care. They deal with people with lung issues. They may even do like tracheal suctioning, which is to help people with like pneumonia or breathing issues. So it's funny. It's the same. Like I could technically go get that job right now. I would not be good at it because I haven't had a lot of training recently in it. But like it's very different than what I do day to day.
Mm,
They're seeing patient to patient. They're very very similar to like a respiratory therapist, an occupational therapist, nursing staff. Like they're in direct care with a patient in a hospital,
mm.
working on them, trying to rehab them out of the hospital. So that is the second one that's called acute care. The third and final one is what's like kind of basically a neuro rehab centers.
Okay. Yeah.
So very, very specific. I have a few friends that work at them. Um, one's out of London where I went to school, and they work like almost exclusively with people that are paraplegic, quadriplegic,
Okay.
and while they're still in their rehab process. So seeing how far they can kind of push people to get them back to like let's say it's a lower back issue and they've lost function of their legs. Okay, well, have they lost complete function of their legs, or can they still do a few movements with their legs? Because depending on where the break is in the spinal column, they may still actually get certain movements from their legs. So that is more the neural rehab aspect of it. So physiotherapy is a pretty massively wide scope.
Yeah.
Everyone tends to refer to what they know as physiotherapy, which is I sprained my ankle, I go see my physio, and they help and they work it out, and then get some exercises and we go home. So I work more in the MSK field, more in the sports related field, but there are these settings in the hospital. Then there's also setting in like a rehab center.
Very, very cool.
Yeah.
And now we were talking earlier about this, but do you only work with the body?
Yeah.
You also have the
True. Yeah.
mental side.
Yeah. Yeah. So we did talk about this earlier. So yeah, like physical therapy, as you would think, is it's about the body, right? Like I'm specialized in what I do, which is treating injuries. I know how the body works. But what I found, and I really didn't expect this a lot until I kind of came out of school and I took one course on it, is how much like cognitively I work with people on like trusting themselves and trusting what their body can kind of accomplish.
Mhm.
So it is physical therapy at the end of the day and hard on the therapy at the end, because a lot of the stuff I work with is or people I work with, especially with chronic issues, especially with like severe pain. They don't necessarily believe that, let's say, the body will heal to where I know it will,
Mm.
right? So a lot of it is kind of building up that confidence in themselves to do stuff. Um, and I'll give an example of
Mhm.
a course I took. It's the guy's name is, if you're ever interested in chronic pain, his name is Dr. Dave Walton,
Mm.
out of University of Western Ontario. He is like unbelievable, really, really well known in the chronic pain community. So I took a chronic pain course from him in second year, my last year of school. And I literally thought going in, it was going to be like how nerve fibers work and like,
Right.
like sodium flood running into a nerve cell, like how in chronic pain it changes and all these other things. I thought it was going to be very physiological. It was almost nothing to do with physiology,
Interesting.
almost nothing. It was almost all psychological. It was, how does our body react to pain when it's been in pain for a while? How does your body function differently?
Mm.
And a lot of it stemmed down to the fact of like, how can you build confidence in someone that believes that they're broken, right?
Mm.
And it's a lot in the way you talk, like, and I know we've talked about it before too, Jess.
Mhm.
Like it's, you know, how are we doing today? Oh, well, this is bad and that is bad and this. Okay, but what was good? Oh, well, this was good and this was good. And this, it's almost changing your mindset on, like, yeah, you had a couple bad days, but I also had like 4 good days. It's like,
Right.
okay, so you had 4 good days.
Right.
You know what I mean? You had 3 days that were not great, but you had 4 great days this week. Let's look at that.
Yeah.
And it's not just being like a crazy optimist. That's not really what it is, but it's going, you know, I do this a lot with patients with severe low back pain. They go, my back's broken. I can't lift stuff. So
Mm.
when I treat them, and a lot of the time we're in the office, I'm working on pain, we get the pain levels down. But what I always do with a person with low back pain is I get them deadlifting. And I know everyone goes, oh my God, deadlifting is so bad for your back. And I go, okay, well then how do you pick up groceries off the floor?
Mhm.
Like, you have to deadlift them. Like, it's as much as you don't want to, you are deadlifting. Now, a lot of people will try and squat, which is another way of doing it, but a very functional way of moving is a deadlift. So I get every patient with low back pain to deadlift, and I get them to deadlift fairly heavy before they leave. And by fairly heavy, I mean usually close to their body weight.
Mm.
And these are people with disc bulges, sciatica, like some of the worst stuff. And I get them to do that because psychologically, they go, I can lift 135 pounds or 150 pounds or 200 pounds. I can lift pretty much anything. Because if you
Right.
think about, weight in the gym is very different than weight outside too. And again, cognitively, that helps them a lot. So I go, a 50-pound kettlebell, right? Like if I were to say, hey, we're gonna go lift a 50-pound kettlebell, you'd be like, okay, like it'll be heavy, but sure.
Mhm.
Like a 50-pound kettlebell is like two of those giant jugs of water that you would take out of, Canadian Tire.
Oh, wow.
Yeah. So if you think about like weight wise, like
Yeah.
when do you ever lift that? Like almost never. And if you did, they'd be like, wow, that's a lot of weight. Where people do it in the gym all the time and no one bats an eye, right?
Right.
Like if I go squat, let's say 300 pounds, I'd be like, yeah, that's a pretty good squat day for me. But like I see other people squatting 500.
Right.
When do you ever squat 300 pounds? Like that'd be like two of your family members. Like no
Right.
one ever does that, right?
Yeah.
So weight in the gym is very different than weight outside. So when you get someone to lift, let's say 100 pounds, and I mean, an example is I had a lady that was in her like late 60s, and she lifted 100 pounds. And she was like, well, that wasn't much weight. And I said, when was the last time you ever lifted anything that was 100 pounds? And she goes, that's a good point. I'm like, you know how much your grandkids weigh? 30 pounds. So you can definitely lift them up now because that's what she was worried about.
Right.
So cognitively, and this is where that psychological aspect comes in. She goes, Well, now I'm not worried about lifting my kids up anymore or
Mhm.
my grandkids anymore because I lifted 3 times their body weight. So, I might, so now psychologically, she's stronger. Like she can now move better. And this is where I'll kind of tie it back into the movement as medicine. She's not afraid to move. She's not
Mhm.
afraid to bend down and pick up stuff. So every time she now bends down to pick up something, she's actually strengthening her back that much more. She's doing
Right.
those movements that will now perpetually strengthen her throughout her life, as opposed to avoiding it and only squatting to lift or maybe only lifting 5 pounds. It just makes the system worse, right?
Yeah.
Whereas if you're not afraid to do it, you'll actually be able to do more of that.
Amazing, yeah. So
So
it's the confidence building portion of it, and then when it comes to low back pain,
yeah,
as a disclaimer,
yeah.
you work your way up to
Yes.
the
Yeah,
high
yeah.
weight. You don't
Absolutely.
start off on
No, yeah.
that.
And I mean, each one is different. Low back is for sure one of the biggest ones I see. And yeah, some people we may not deadlift for 4 months. Some people we may deadlift after 3 weeks. It depends on how bad their injury is, how long they've had it for, a multitude of different things. And yeah, like sometimes it's surgery, sometimes it's just 8 months of pure treatment. And here where I'm just working on loosening up the muscle tissue and trying to get the hips moving better, trying to get the hip back moving better. And we don't even touch a weight
Mm,
for 8 months. But
you work your way up.
almost always it is we will get them there and we will get them lifting heavy before they walk out that door because I don't want them walking out the door and still being afraid that, oh, if I slip and do something, then my back's going to go out again. I would rather them leave here going, my back is strong. It's stronger than it was when it came in. It's actually stronger than it was prior to injury because that's really what keeps people from coming back for the same injury, is the exercise kind of piece of it and the confidence to continue strengthening it.
Amazing. Yeah, 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 for sure. And then when we're talking about like switching gears from musculoskeletal to like chronic illnesses,
Mhm.
does exercise help with chronic illnesses? And then we talk about we talk about like exercise intolerance
Yeah.
with chronic illness. Like, should those people exercise still too? And
Yeah, so like chronic illness is obviously a world that I am not incredibly familiar with. I see a few people, you being one that
yep.
we've worked on stuff. So
Yeah.
um like obviously each chronic illness is gonna be different, right? If you're and you're always gonna want to have like your specialist, whoever your specialist is specifically, to tell you, yeah, like it is okay to safely exercise under guidance of someone. But yeah, like really exercise intolerance, just like anything, if dosed properly, can be removed, right? Like I said, just back to the back example, right? If someone can only lift 2 pounds, and then when they get up to 5 pounds, it hurts. Perfect. Let's lift 2 pounds
Mhm,
until 2 pounds is so easy that when I give you 5 pounds, it doesn't hurt me,
mhm,
right? And then when 5 pounds doesn't hurt anymore, we go to 7, 10, 15, and 20, right? So same with exercise. Let's say let's say you have something where you can't work out for more than 5 minutes.
mhm.
Perfect. Do 3 minutes, right? And it's like if you dose anything properly, I'm a firm believer that if you dose almost anything properly, it can be changed.
Mm,
Now, the other thing on the piece, specifically with chronic issues, is chronic illness, is that a lot of times people will go so hard that they kind of wear themselves out, right? So you
mm.
go so hard, you're like, I'm going to start exercising, and I know I can, let's say, bike for 10 minutes. But you bike for 10 minutes, then you're out for a week,
Right.
right? Because you're just so tired. Your body hasn't recovered. You've taxed it a bit too much. So that's where I say, do 2 minutes.
Mm,
Do 2 minutes every other day for that week, and the next week you do 3 minutes. The next week you do 4 minutes,
mhm.
so that you can get more repetitions in without completely like ruining your week, because now it's like you've basically set yourself back so far because you've tried and then boom, you like failed per se because your body just gave out, right?
Right.
So it's more about like finding the right dosage, and yeah, you might be able to do 10 minutes extra or 15 or 20, but don't go right to 20. Don't go right to like red line.
Right.
Stay in that nice yellow zone so that you can get back to your green zone within a day or two, and then you can do it again,
Mm,
right? So it's like with anything, if dosed properly, I think you can kind of achieve a lot of things with it. And obviously each illness is different. And no two are going to be the same, right? But it's if you do it kind of in a way that you aren't, and I'll use this term, like basically setting yourself up for failure.
right.
Because if you go so hard and then boom, you're like, no, I'm done. I can't do it. And then next week, no, I'm going to do it again. Now that you do another thing, you redline yourself again. You're out again for a week. You're just going to go, well, then there's no point. I'm not going to be able to accomplish this.
Mhm.
Whereas if you give yourself less and then build up to that 10 minutes or build up to that 50 minutes. I think that is a more realistic way to do it.
Yeah.
Because like realistically that will allow your body to adapt just like anything else. Like I wouldn't go in today and try and do like 100-pound bicep curl because
Right.
I don't do that right.
Right.
So my biceps would probably be either torn or really painful if I were to go do that. But if I, let's say, started at 20 pounds and then 3 months from now I did 30 pounds and 3 months from now I did 50 pounds. I mean, I probably never got up to 100, but
Yeah.
realistically, I could get to a point where I could go really heavy
Yeah.
and it would not hurt me, right? Because
Right.
I've allowed my body to adapt, and bodies don't adapt over weeks; they adapt over months, right?
Right.
So it's about being slow and
Yeah, and that's like how I've been working with you for over a year and a half now or so. And
yeah,
when we started, I would do an exercise and we would take lots and like long breaks in
yeah.
between each exercise, and then I'd be out for like 3 days maybe. And now I'm getting like
Well, now
a
you're
second workout for the
yeah, you're
week sort
doing
of
other
thing. And
workouts throughout the week, and
yeah,
this is yeah, and again, it's like all about like dosage. So when I like first met you, is like we did a few things, and you're like, oh yeah, I was out for like 5 days, and I'm like,
yeah,
perfect. So that gives me an idea that what we did was probably a little bit too much. So we just dial it back a bit, go again. Okay, yeah, that was better, perfect. So then we kind of find that line of like what is enough to make a difference, but not too much to set you back, and that's really where like any physiotherapist that works a lot with exercise and exercise rehab will be able to find that fine line. That's kind of where we
mm,
come in, and not just us. I mean, athletic therapists, I believe, have a pretty good training in this, and so do personal trainers, especially ones that have worked a lot in that field.
hmm,
Um, Kinesiologists too, to some degree, because they have the background. Right? You got to have a little bit of a physiology background as to how the body recovers, a little bit
right.
more than like the bro science of like I do
The
chest and
bro
back every day.
science.
Yeah, more than just oh, you need 2 days to recover from chest and back. No, you need to have an understanding of, especially with chronic illness, that it's not just the muscle fibers, coming back. It's the fatigue level, it's
Hmm.
the sleep, it's everything, right?
Yeah.
So yeah, and I mean, especially with our stuff, right? We started off really gradual, and it was, and I mean, we talked a lot about even like the self talk and the confidence, and it was like, you look at me sometimes like, yeah, we're gonna do this, and you're like, excuse me, and I'm like,
Yeah.
yeah, you got this, Jess, like trust me, and then yeah, inevitably you do it, and it's like, what? How much weight did I get today? Or don't tell me until I finish, and
Don't
then
tell me.
all of a sudden you're like, wow, I did that today. So
Yeah.
and it really does, it makes a big difference. And then there's a lot of stuff I do that I just don't tell you that you're doing it. Even like calf stuff, right? Like the
Oh
amount of,
yeah,
amount of
yeah.
calf stuff we started to add, that we never could do before. Push-ups, for example, like we've
Yep.
done some of that stuff you couldn't do into those positions
Yep.
before. But we gradually worked in more and more stuff, and now it's like, oh yeah, I can do that. Like yeah, I feel it, but it's not nearly what it was, right?
Yeah.
So yeah, again, all dosage, just all little tiny steps, baby steps each time, and
Mhm.
if it's like if you're finding that it's failing, you're like constantly failing, it's likely your steps are too big.
Right.
It's likely you're expecting too much of your body, and just like whatever you're doing, cut it in half. And then when you make a jump, instead of making that full jump, cut it in half. You will start to notice progress, but again, months. Like it's not it obviously
Yeah.
is never a quick fix with that stuff. So,
Yeah. No, for sure. And then my last question for you today, at least,
mhm.
is how can people implement movement into their daily or weekly routines, even if they feel like they can't be lifting lots of weight?
Right. So like more like how can they fit it into their like routine if they're like too busy, or like if they feel like they can't do a lot of exercise,
We're gonna go on the like more like if they had a chronic illness or a chronic injury, like on
where they
their
feel like they can't, like they're not like getting a workout in per se.
yeah,
Yeah,
they
yeah.
don't feel like it's a full on workout.
Yeah, so like yeah, like really anything, and that's I guess I'll go back to like the movement is medicine
Yeah.
thing. Like literally anything can be exercise. So like yeah, if you can't like lift weights, like I don't know how many of you have done yoga, but like yoga is hard.
Mhm.
Like I'm not a big yoga guy, and I find it so hard to do. So it's like you don't need to go into the gym. You don't need to get a gym membership and lift weights. Like there's a person that does yoga on YouTube, and my wife loves it. I can't
Yoga
remember.
with Adrian.
Yeah,
I
yoga
love
with it.
her.
This is
Love.
Adrian. Yeah,
Yeah,
every
yeah,
time.
yeah,
Yes.
yeah, yeah,
Yeah.
yeah.
So like something like that. I mean, some of hers are like 5-6 minutes long.
Yep.
Perfect. Do it. And let's say you can't get through a full one. Like let's say she has like a 20-minute one on there. Do 10 minutes. You know
Yep.
what I mean? Like start with yoga. Start with a walk. It doesn't need to be a huge amount of like clanging and banging weights. It's really just like get get some movement in, and then you can start to add weights. Like if it's taxing for you to walk 10 minutes, well, then I wouldn't say go do burpees, right?
Right.
Like it's too
Yeah.
much on the system. So
Yeah.
start with a walk, and then you get up to 15-minute walk. Then you get up to a 20-minute walk. Now you're doing a 20-minute walk fast to the point where you're getting maybe up to your heart rate of like 125, 130 beats per minute. Um, a lot of it is tracking stuff too, and I
Mm,
and I do a lot of the tracking with our stuff, obviously with my notes and stuff. But if you don't track stuff, you'll never know if you're progressing either,
mm.
right? So you have the watch. I now have the watch because you've convinced me to be an Apple person.
Yes, I have.
Um, but tracking data on your watch, even right, like if you go for a walk and let's say you can only do a 10-minute walk, you do a 10-minute walk 1 week and you're at 105 beats per minute, and then you do a
Mm,
10-minute walk 3 weeks from then, you're at 130.
mhm,
You've now pushed yourself probably further,
mhm,
but you've also pushed yourself at a higher heart rate, which basically means you've been working harder.
mhm.
So that is still progress. Even though you've only walked 10 minutes, you still pushed yourself harder. Maybe you did more hills that day than you realized, right? So you got to track stuff too. And maybe a way of working it into your daily routine is just starting out with small steps and literally logging what you've done. And it doesn't need to be every day. Sometimes it's 3 days a week, sometimes it's 2 days a week. I find a lot of times people go, well, I'm going to now exercise 7 days a week and I'm
Right.
just going to do a little bit. It's like, I don't exercise 7 days a week. I work at a gym. I
Yeah.
don't exercise 7 days a week.
Yeah.
I exercise 3 to 4 days a week. I try and balance out my lifestyle because we're all busy. We all have jobs. We all have stuff to do. I like there's some day like today I'm not gonna exercise. I gotta go home and work on a nursery. So you know what I mean? So
Yeah,
it's like
yeah.
I just don't have time. So it's like I'm not gonna like beat myself up because I didn't make it into the gym for 5 days this week.
Right.
Like I made it in three. Cool. Like
Yeah,
maybe next week I'll
yeah,
try and do four. You know
yeah,
what I mean?
yeah.
But if I log these things, right? And then so I'll go back to like even you're tracking your data. You get up to your 10-minute walk, let's say, and you're at 130 beats per minute. Well, now maybe you do some squats, then you go on your walk,
Mm,
right? Then maybe you do some squats and some lunges, then you go on your walk. Maybe you do now some squats, lunges, wall push-ups, then you go on your walk. Now all of a sudden you're up to a 30-minute workout with 10, 20 minutes of weights and then 10, 20 minutes of walking, right?
mhm.
So now you've started to work that into your routine and you're now actually starting to see progress, but it doesn't have to be at a gym. It doesn't have to be doing bench press. It doesn't have to be doing that stuff. Any type of movement, you will notice serious headway even without weight. Like a lot of body weight stuff you can do.
Right.
And a way of like working it into your routine is you got to find out like what does work best for you. Like I am for sure a morning workout person.
Mm.
Like even though as much as I hate mornings, I will get my workout in the morning almost always if I get out of bed and do it. Like if I leave it to after work, I'm like, yeah, I'll do it. This doesn't happen, right? You're like, you start thinking about all the stuff you got to do at home, and then it inevitably doesn't end up working.
Right.
Friends of mine love to work out after work. So they literally finish work. Before they even go home to eat, they go right to the gym, they work out, and then they eat after. And it works for them. So you got to find what works for you too. Like,
Yeah.
you're not a morning person, you hate working out in the morning, well, don't push yourself to do it because it's not sustainable either, right?
Right.
To find something that is going to work for you and is sustainable because it is not a, I'm going to be so cliche here. It's not a destination, it's a journey.
Oh, okay.
Yeah,
No,
but
yeah.
it's true though,
Yeah.
really. Like anything in fitness, I mean, you could work super hard and track everything and do all the right things for 3 months and make
Yeah.
a bunch of progress. But then if you like can't sustain it, the progress is going to diminish and it's going to go away probably in just as fast as it came 3 months,
Yeah.
right? So it's like unless you can make it sustainable, there's no point in doing it that way,
Mhm.
right? So and maybe you have friends that you work. Maybe it's like you get a group of friends together, y'all go for a walk, y'all do a workout together. Maybe that's the way you do it. And like you find ways to make it sustainable for you so then it becomes a habit. And again, it doesn't need to be every day, but 3 or 4 days a week to start with something and then you can kind of work.
Yeah, wonderful. And then I did lie. I had one more question for you.
Okay.
Yeah.
Classic Jess. Okay.
Is we talk about like exercise intolerance a lot here. We did a lot of training, you and I, with like the orthostatic intolerance training. Can you just like briefly explain? We're talking specifically like on the high heart rates that spike when I started here, like I couldn't stand for more than a few
Yeah.
minutes and I was getting really, really high heart rates. Like, how did
Yeah.
we train that?
Yeah. So like I've only seen one patient other than you with POTS.
Mhm.
Okay. And I did not work like this with them. So yeah, basically when you came in, I obviously did some more digging into like what it was and how it reacts. Um, and like there is some literature on exercise and stuff for it. What I kind of did was I looked at the idea of like the body wants to control its heart rate,
Mm,
right? Like the fact that this happens is obviously not something that happens to everyone. but the body is trying to control its heart rate. It's just obviously confused with a few different mechanisms that are going on, right? Which is exactly it's
Confused.
confused,
It's
right?
confused.
So the body wants to be able to control at these different situations. So my idea really is, if again, dosage wise, if I dose this properly, can we get Jess's body to realize that exercise is not a bad thing, that standing up is not a bad thing, um, and not something that requires the heart rate to always spike,
Mhm.
right? Um, and that's really what I'm trying to do is get the heart up. And I mean, we've had it up high a couple times, like quite high.
Mhm.
And you've been at the point where you're like, yeah, like I'm gonna sit down, but like it comes back down and it feels like fine. It feels like you're now at the point. And I'd even say maybe the last couple months we noticed a big breakthrough with that, where it's like, no, I just feel like tired, like I feel
Yeah.
fatigued,
Yeah.
which is perfect, as opposed to I feel
Like,
dizzy. I feel like I'm
yeah.
gonna drop. Right?
Yeah. Yeah.
Glad we haven't had that.
No paperwork.
Exactly. Yeah. Yeah. Less paperwork.
Yeah.
But no, it's true. It's one of those things that the training that we do is to basically jack your heart rate up quite high,
Yeah.
and then basically, okay, now come back down. Now jack it back up, come back down. So it's constantly going over that threshold that was perceived before as a bad thing for you.
Yeah.
And we are now kind of continuing to reinforce the body that no, this is what is required. We are doing work, we are doing lifting, or we're doing cardio that requires a high heart rate
Mhm.
in order to basically survive, in order to keep your muscles moving, to keep blood flow to your muscles so you can keep lifting.
Yeah.
So that high heart rate is required and is a good thing for your body. And then, okay, we're done now. Let's bring it back down.
Yeah.
Oh, we're not done yet. Let's bring it back up. So constantly going over that threshold is what I try to do with you, is to get you to that point where basically the body can now, and even with your running and biking, you can now sustain a high,
Mhm.
and your body's not like, whoa, what's going on?
Yeah.
I don't like this. Instead, it's like, all right, yeah, we're running, or yeah, we're biking, or we're swimming, or whatever, right? Like we're doing stuff that I need to have a higher heart rate for. So yeah, let's go. Let's keep doing it. Right.
Yeah.
So again, dosage wise, it was not like that at the start. The high heart rate would go up and it'd be like, let's have a seat, let's bring the fan over, let's calm down a bit.
Yeah.
And then we'd try it again. Right. But over time, we've started to get the body to realize that it's okay to be up in the 150s, 170s sometimes.
Even higher sometimes. Yeah.
Exactly, but
Yeah.
it's okay to be there, and that you know that your body can now kind of regulate it back down, and
Yeah.
I think that helps the system a lot, like to realize that it can go up and down like
Yeah. And the strength training and the orthostatic intolerance training, like that's been over the course of like a year and a half, and it wasn't overnight.
that.
It was like,
No, yeah, like it was like yeah, and I mean, I remember I'm gonna say if I looked at the notes, I could know too, but it was I'm gonna say maybe it was like 8 months ago. We were like cruising. Like I was like, you were like killing it. Every time you're coming in, it was better and better, better. And then things set back. Like you had some setbacks for a couple months.
mhm.
And yeah, we just like literally all I did was like, all right, well, we're just gonna dial it back. And
Yeah.
it didn't take long before we dialed it back. You kind of inched your way back up. And before we knew it, you're back kind of cruising again. And then I'd say like again, even in the last like 3 months, I've noticed a big change in your ability to just do more. Like now that you're doing
Yeah.
workouts throughout the week, and then you're like, oh yeah, I did this and I did this in the same day. And it's like,
Mhm.
okay, like I like that's not something that would have happened before, right? So
Right.
that's
Yeah.
huge. And I'll leave you this too about
Mhm.
any type of injury. This is not just chronic illness. This is almost any injury. Um, I equate recovery to the stock market.
Oh,
Okay,
okay.
so imagine a stock. Okay, let's say a good stock, hopefully.
Okay. Yeah.
But no, I equate it to the stock market. You'll have weeks where it's incredible, things are going up nicely, and then
Mhm.
you'll have dropbacks. Okay, you'll have another week where it goes incredibly, you have dropbacks. So you'll always have setbacks with almost anything. Like literally, there's very few injuries that I don't have setbacks with. But as long as you are trending upward, that
Mhm.
is what you're looking for. So like I had a person literally yesterday that ankle sprain, which is like one of the most basic things I can treat. Usually it's like 4 weeks therapy. Okay. Trending upward, boom, all of a sudden, for whatever reason, they didn't roll it or anything like that. Ankle was super sore for like 3 days. So like,
Mm.
what did I do? I like injured it again. I'm like, I'm back to where I was. I'm like, trust me, you're not. Like you've already had like 3 weeks of treatment. You're doing really well. You're way stronger than you were. And sure enough, it was literally 3 days and then they're back up again.
Right.
So expect expect the highs and the lows.
Mm.
But as long as you're still trending upward, like that stock trends upward, that's what you're looking for. That over the course of 6 months, you're up 20% or 40%. Over the year, you're up 80% or 90%, right?
Right.
Now, no stocks perform like that, but
We have to find that
We have
stock.
to find that stock.
Yeah.
But ideally, that's what it looks like. If you were to look at just like a stock market, that is literally how injuries heal. It's up and it's down. It's up and it's down. It's up, but you're trending forward and upward ideally.
Right. Yeah. No. Wonderful. Well,
Yeah.
thank you so much for joining us
Well,
today. I
thank you.
appreciate it.
Thank you for having me.
And we'll hear from you again soon because
Okay.
we'll have you on a part two
Part two
of physio.
physio.
Yeah.
Okay,
Yeah.
sounds good. After you've watched all the Star Wars movie.
Oh, is that the criteria?
Yeah. I don't know
Oh,
if we'll still have
I don't
podcasts
know.
by then.
Yeah. Wonderful. Well, thank
Yeah.
you so much.
No problem. Thank you.